Hi, I'm Haley and I'm here at Aletheia Integrative with Dr. Dodge, and we're talking about our practice a little bit and then also our therapy with NAD. Dr. Dodge, could you just briefly describe and introduce yourself and your practice that you have here?
Hi, thanks Haley. Dr. Jamie Dodge, and here at Aletheia Integrative, where I'm the medical director, we offer a number of transformative IV infusions, really helping people make shifts in their health and move them forward. So all of our therapies are designed for internal health and enhancing those mechanisms that promote that.
Nice. So what first sparked your interest in offering NAD therapy at your clinic?
Sure. Well, it really aligns with helping people optimize their health, finding root causes and addressing those, and really improving their longevity and with a personalized approach. So NAD really is at a cellular level enhances mitochondrial function, and that's the engine of the cell. So what it does is help you regain energy and mental clarity and internal health all improve.
Okay, cool. So you kind of went into a little bit about what NAD does, but for those that aren't experienced or familiar with NAD, can you talk about like what exactly it is, and then does our body naturally produce that, and why would they want to get the therapy?
Sure, our body does produce it, it just decreases over time. It's essentially an energy mechanism for the cell. So your cells are designed to live a long time, but they have to produce energy. So NAD is one of those means that actually increases longevity gene expression, it produces energy as well, and repairs DNA, which is essential for ongoing health and longevity.
Okay, so for those of us like me who don't have a medical background, what does gene expression mean when you say that it helps with that?
Sure, so gene expression is essentially like if you had a light switch in a room, it may not turn on the lights, right? So to be helpful, the gene has to be present, but then you have to actually express it or turn it on.
Okay.
So NAD helps express those longevity or healthy genes.
Okay, that makes sense. So what convinced you personally about the efficacy of the NAD therapy?
I think really just seeing both scientific studies where we're seeing improvements in brain health, mental clarity, energy, regeneration, and just overall health, but also hearing what patients are saying too about how good they feel after an infusion or a series of injections. And that's really just powerful when you see those effects and hear them from people firsthand.
Yeah. So I'm thinking of like chronic, like dementia, or maybe some more like other serious health concerns. Who would be like an optimal patient to get the therapy?
Well, number one, really anybody just looking to improve on maybe some existing fatigue or brain fog. That person's going to feel improved energy, mental clarity. Number two might be somebody that's recovering from something like a recent injury or illness or surgery, and they may need a little bit higher dose or slightly different approach there. And finally, as you mentioned, somebody that's maybe experiencing some more serious cognitive decline or memory issues, or has been beset with some type of severe illness with residual symptoms, like maybe post-viral, post-autoimmune, or flare-up of some type of inflammatory or autoimmune condition. They would also feel some benefits from the enhanced cellular energy and begin to recover internally.
Okay, that's good to know. So we here like to integrate a lot of different therapies and treatments, and how are we specifically integrating NAD into the rest of our options here?
Sure. Well, we've designed it in most cases where we'll have people come in for a series of what we call loading or enhanced reset protocol, where they receive a series of injections or infusions over time to build up levels to a high level, and then place them on a more of a maintenance phase, where then they would receive a periodic, either monthly or twice monthly infusion or a series of injections. But we couple that with lifestyle changes that we would suggest. We work on improving those, and we have a series of supplements, vitamins, nutrients, etc., that are super helpful. They really accelerate everything that our infusions set forth, as well as our hyperbaric oxygen, our near-infrared light therapy, and even transformative and regenerative stem cell based therapies as well.
So when you look at the NAD, how would you look at someone and personalize it with their specific care?
Well, we'd first want to begin with essentially hearing their story. Where have they been medically? What's been factoring in there? And we'd want to know what their goals are. How what they would like to shift away from and move toward. And after hearing that in detail, we can customize really a series of therapies and supportive protocols that can really make shifts in those things. And it can take some time for some people. It really depends on what's going on. Some people feel much different right away. I would say almost everybody notices a significant change. But then over time, it may take a series of months or a little bit longer even to really make the moves they want to make if they're big shifts and really transformative. But it really begins by hearing their story.
Okay, that's good. I know we love to hear people's stories here and kind of partner with them on that. So are there any common misconceptions about the NAD therapy?
Sure. I think some people might be concerned about an injection and they don't like needles or an intravenous infusion, those sorts of things. But really, we have professional staff who do a great job of keeping people in a comfortable environment that's safe and following all the proper protocols and procedures. So really, any concern someone might have, I think they'll find it's different here. It's a better environment than maybe they've seen before.
And I know that there's some concerns about like how quickly you get it with some of the common side effects that are possible.
That's a great point. NAD itself, just because it produces all of that energy, can create sensations like flushing or lightheadedness or some dizziness. So always, especially with the first injection or infusion, we really go slow with that to avoid that.
Okay, that's all really good information. Thanks for sharing. Is there anything else you want to share about the clinic or about NAD?
Sure. I think just when people realize how good they feel after they begin to make these moves with some things that maybe they've heard of or wanting to try, they really come back for more and ask, what else is there that I can do to move forward in my health?
Yeah.
And that's the exciting part about what we offer.
Yeah, it is exciting. Thanks for joining us. Appreciate your time.
My pleasure.